everybody. Welcome again to our NFL Fantasy Football podcast. This is called Start or Sit. This is week 2 of the NFL season. I'm Shannon O'Kelley, and he's Dr. Hawkins, orthopedic surgeon and sports medicine specialist. Just to review with everybody, what we do here on this podcast is we're going to talk about the previous week's injuries in the NFL, and particularly talk about those players that you may have on your fantasy football team, and are they going to be able to start, or are they going to have to sit based on that injury? And again, we're in week 2. Dr. Hawkins, how are you?
I'm doing great, Shannon. Everything's really well. Looking forward to kind of talking this through for another week, and obviously we've got some significant players that are injured.
Oh my gosh, yeah. Okay, so let's get started here. So this gentleman, I feel so bad for him. Second game into the season last weekend. Kupp, Los Angeles Rams wide receiver, super important player. I think he spent majority of last year, if I remember right, he was on injured reserve with, I believe, a leg injury. Maybe it was a fracture or something like that. He's got an ankle sprain now, and they're talking about him going on injured reserve. Let's talk about what's going on there.
Yeah, so, they definitely were a bit concerned about him out of the gate. When he left that game, they had him in one of those high boots, which is usually not a good sign, that they're worried about. He may have one of those high ankle sprains. It came out late this afternoon that they have decided not to put him on IR. So the good news is, I don't think it's going to be obviously something that requires surgery. And I think we're looking at that situation where those ligaments that stabilize that lower part of the bone have been sprained, not torn. So he's going to be a sit this week, 100%. But I think it won't be more than 4 weeks. It doesn't look like.
So he's not going on injury reserve. We're looking at least 1 week out, possibly 2. What we're suspecting based on the boot is this is one of those high ankle sprains, which is different, as you said, from a low ankle sprain. With a high ankle sprain, it's a torsion type injury, and you're tearing tissue or connective tissue between the 2 lower leg bones called the tibia and fibula. Pretty aggressive injury, and it takes a little bit longer to heal because there's a little more disruption. So you're thinking he is coming back maybe in week 2, week 3, but not this week for sure.
Yeah. I think it's probably going to be, so I think he's going to be a week 5 or 6 return at this point. But Again, everybody has to keep a good eye on him. Yeah.
Okay, that's good to know. It's interesting. I was looking at the NFL this weekend, watching some games and kind of paying attention to it. It's interesting. These potentially playoff teams that were predicted to be in the playoffs, i.e. the Rams are now 0-2 and going into this weekend's game with the potential they could be 3-0. They're playing the Cardinals, and the Cardinals were on fire last week in their game. So, the NFL is kind of flip-flopping here. Here's a team that is coming off, a fairly decent record the last several years, but this guy's super important to them, and that's Isiah Pacheco, running back, Kansas City Chiefs. This guy's out. He's got a fibular fracture, it sounds like, and I think he's slated for surgery. Let's talk about what's going on with Isiah.
Yeah, so you've got two bones in the lower part of the leg. The tibia is kind of your main weight-bearing bone, and then the fibula kind of provides the stabilization on the outside part of the ankle. So if you have a fracture there, especially sort of at the level of the ankle joint or just above it, it is unstable. So we will generally recommend that that's treated surgically by going in and putting a plate and screws on that will line things up and anatomically hold them in place while they heal. But like you mentioned, that's going to end up being a 6 to 8 week healing process. So he will definitely be out and on IR.
Well, as an orthopedic surgeon, Dr. Hawkins, I mean, when you're talking about the fibula, that lateral bone or the outside bone, it's a small one compared to the tibia. But my understanding from a healing perspective, the fibula, does it have a little bit of a hard blood supply, kind of a limited blood supply? Are you guys concerned about healing? And is that why you want to stabilize this with some hardware?
Yeah, it's definitely, especially for somebody who's an elite athlete, because you could probably, I'm 55 now. If I had a bad fibula fracture down low and it was mildly displaced, I might leave it alone and try to just protect my weight bearing. But for an elite athlete, it really changes the contact pressure through the ankle joint. It puts you at a lot higher risk of progressive arthritic damage. So you're going to potentially shorten your career, not only run into problems later in life, but even in the short short term. So we're going to tend to be very aggressive in treating those in an athlete or a younger person to try to have it heal, anatomic.
Well, this is a huge loss for Kansas City. This guy's this guy runs hard. I mean, he's a hard runner. He's productive. If you have him on your fantasy football team, that's Isiah Pacheco. He is out for at least 4 weeks. He's on IR, probably going to go somewhere in the terms of 6 or 7 to get back on the field. Fair to say, Dr. Hawkins?
Yeah, exactly.
Wonderful, wonderful. Hey, here's a team that, man, I tell you, I think this team has got a possibility to definitely get in the playoffs. But have you seen Houston Texans play?
Yeah, they've done great. And, everybody saw what C.J. Stroud was able to do last year. And he's shown a lot of maturity and how he handles things. Obviously, the opposite of what we've seen with Bryce Young, and I remember when both of them were getting drafted, it was sort of like which one to take. And obviously, some guys that spend a lot of time and energy got it wrong in Charlotte, or in Carolina, obviously.
Yeah.
But yeah, I think Houston's got a good chance to do well this season if they stay healthy.
Yeah, and Joe Mixon is he's pretty good sized back, really good producer, put some yards up. He's the running back for Houston Texans. I watched this game. It was interesting. He went down really kind of a strange tackle. I think they're calling this thing a hip tackle this year. There's some kind of terminology, and it's hard to call in the field, but it's an illegal tackle, and I think the Houston Texans are trying to kind of find out or appeal to the NFL about a bad tackle on Joe Mixon. But you watched his ankle get rolled up. You saw it on TV. It looked really painful. He stayed down. He got up. He limped off. He was weight bearing a little bit gingerly. He came back in the game, though. And I think he's got this ankle sprain, probably what you guys describe as a low grade. Maybe we can talk about that. He's hit or miss this weekend for play, I think. What do you think?
Yeah. I think the good news for him is I think he got lucky. We saw a few weeks ago with Jordan Love at the end of the game. He had kind of a similar mechanism, though not exactly that illegal nature. But it's the whole idea that they're calling it a hip drop tackle. That's what they're calling it now, this illegal tackle. But it's that idea that a big guy comes in and sort of leans into you, grabs you at your hip, and then he drops his body down and lands on your ankle basically while doing it. So it's at a high risk if you get that torsion, that twisting motion, that you're going to get a high ankle sprain because those bones, the tibia and the fibula get spun open. But actually it looks like he got lucky. It did twist, but it was a sort of a low-grade ankle sprain. And at least right now, I think he's a better than 50% chance that he'll be playing this week. So I would put him in the start column right now. And he might have limited touches. He may not play as much, but I think he looks to be turning the corner quickly, and it's just sort of like a low ankle sprain.
This low ankle sprain again versus high ankle sprain, a lot less disruption to the tissue. It's probably a low grade, meaning there's probably a little bit of stretch of the ligaments there, but you're thinking 50-50. Start him. Good chance he plays. Keep an eye on him. And that's how we're going to roll with Joe Mixon. Houston Texans look good. I'm telling you. Here's another team that, I tell you, these guys, they shocked me. They beat San Francisco. They beat San Francisco bad, if I remember right, and that is the Minnesota Vikings. And I watched this wide receiver on one of his touchdowns. This guy is an athlete. He's important to them, and that's Justin Jefferson, wide receiver, quadricep injury with the Vikings. Now, remember, he was out pretty much all last year, right? If I remember, he was out most of the year last year. Am I recalling that right, Dr. Hawkins?
Yeah. He struggled a lot last year. He's one of those kind of long, thin wide receivers. And, those guys are like, they're like finely tuned, F1 race cars. If they have one little thing that's off in their steering, like they can't race.
Yeah.
So, but the good news for him is the quad injury, it does not appear it was a tear. So it wasn't one of those things where the tissue got stretched too far. It sounds like it was basically a hard tackle into the quad. So like a contusion. Typical thing that causes usually some local swelling, a little bit of bleeding in the muscle, maybe a small hematoma, but no tear of the muscle. So he's one of those guys, they get him right in with the physical therapist. They get him right in with the training staff, get the swelling down, work on stretching. And it sounds like his injury has been responding very well. So I think he's going to be a play. And you're right. They're a bit of a surprise. I don't think anybody thought Sam Darnold would be able to step in and, take over as an elite quarterback. given his track record with the Jets and stuff in the past. But he may have fallen into just the right circumstance for, he's a big guy with a big arm and great wide receivers and options out there. So I think we all have to keep an eye on Minnesota, and I do think Jefferson will be a start this week.
Justin Jefferson, wide receiver, Minnesota Vikings. Your Minnesota Vikings, folks, is going to start this weekend with a quad contusion. Here's another team that just looked like no one was going to beat them. And again, I watched their game week one. I was like, boy, who's going to stop San Francisco? And this guy is super important to San Francisco. Obviously, we just talked about the Vikings beat San Francisco. But Deebo Samuel, man, he's wide receiver, but he's running back. He's all purpose. And he has got one of these injuries, him and McCaffrey, right? One of these calf injuries, these calf strains. And, boy, I don't know. They got a road game this weekend, I believe, against the Rams. And it's got to be a win situation for both teams, really. What do you think about Deebo Samuel and his calf injury?
Yeah, so he's the good news is it doesn't seem like it's Achilles, and it does seem like it's sort of the non-technical term. Some people call it a tennis leg, but what it is it's a little bit of a muscle tear in the medial, the inside part of the calf muscle, what's called the gastrocnemius. And so they're painful. They obviously hurt. They make it more difficult to push off. And using that same example of like an F1 race car, he's a guy that if he's got something that's going to hold him up to push off quickly, they're going to err on the side of caution. We talk about it every year, Shannon. We have these teams that are juggernauts, and then they get hit with a few injuries. Yep. And, you might be seeing something happening here with the 49ers, which would make the Seahawks fans happy. Yeah. But, McCaffrey out, kind of indefinitely right now. And now Deebo will be a sit this week. They're not going to take a chance with him. They're going to try to, obviously take advantage of the fact that the Rams might go to 0-3 and they get up to 2-1. But yeah, Deebo will sit this week, and I think he'll be a week-to-week decision. I wouldn't be surprised if he misses the following week as well. Yeah,
that's what I read. I was looking at that injury, and they're saying 1 week for sure, possibly 2, and even go 3. And I'm sure a lot of folks out there, I know I would have him on my fantasy football team. He's a producer. He's quite an athlete, all-purpose yardage player. He's out for this week for sure. Keep an eye on him week 2 and 3. It's interesting. We talk about teams potentially going to 0-3, and the Rams are one of them, or the Rams, and then the other one is the Ravens. They're 0-2 right now, and there's another team out there. So the whole NFL parity is kind of flip-flopped. It's amazing what the draft can do for that team that's in last place, right? So that's why it's there, right? Hey, Dr. Hawkins, have we ever had a kicker on? Have we ever talked about a kicker?
It is few and far between. That's for sure, Shannon.
Yeah, I don't. Yeah, I think people even say, is it really even a position, right? I've heard that before. Man, these guys are super important to the team. I think there was a win last week. I can't remember what team it was, but one of the teams that won, they kicked 7 field goals, did not score a touchdown. I think the kicker had 6 or 7 field goals. So pretty important when you look at 3 points. I think the leading point producer in the NFL over time, sometimes on the top 5, sometimes there's 1 or 2 kickers in there. Gano, New York Giants, kicker, hamstring. I believe the hamstring on his kicking leg. Mechanically, you cannot kick a ball if you have a hamstring injury on your kicking leg. Fair to say? Tell us what's going on.
Yeah, you hit that right. A lot of people would kind of think that obviously the quadriceps is the main thing because you think, I'm extending my knee and I'm kicking a ball. But as you and I know, that hamstring is what controls it, what slows it down, what allows you to kind of not have your leg go too far. And so, a kicker is they're trying to put everything behind that. And if you don't have the ability to decelerate, you have no ability to put power into your kick. You have no ability to control it. So this is a bad injury for him. They've already said he's going on IR. Some of that's because there's a lot of good, college kickers out there looking for jobs. So they can usually fill in and find somebody, but he's got a good track record. I think in the past, he was a Viking in the past, but he's been around the league a while. But I think you always have to be worried when kickers get substantial muscle injuries like this, especially on their kicking leg. you really worry about, is 4 weeks enough? Does he need 6? Does he need 8? So, anybody out there who has him as a fantasy kicker, I would just drop him off your team and, roll the dice. One of the guys you mentioned, I think, was Boswell, the Pittsburgh kicker, week 1. I think he had like 25 fantasy points because
I know.
You're right. That's how they scored like everything. So go find that team that can't move the ball and their quarterbacks are only so, and go pick up another kicker from there and get rid of Gano for now.
Exactly. He's on the IR anyway, so he's going to be out at least 4. Hamstring injury, like you described from the mechanics of kicking. It could be 4+. Here's the interesting thing in the NFL. I was watching it on Sunday night, and it's nothing anymore to run these kickers out for 60-yard kicks, 61-yard kicks. When I was a kid, there was a guy that had he had the half shoe, half foot. I think his name was Dempsey for the New Orleans Saints, and he kicked a 60-yarder, I think, or a 59-yarder back in those days. That was huge. These guys are doing it like it's eating sliced bread. I mean, you know what I'm saying?
Nobody thought 60 was a normal thing back then, and you probably remember this, Shannon. But they always said that part of it, he had half a foot, and then he had like a lead weight in the front of that foot, in the front of the thing. So it was supposed to be protecting the stump, but I think it gave him like 3 extra pounds to swing and hit it. So he was hitting it with a small sledgehammer.
And he was not your typical. I remember watching this guy, statue-wise. He was kind of short and kind of had big lower legs and stuff like that, but he could boot it. But like I said the other night, they're just running kickers out with 62 yards like it's no big deal. So interesting. Hey, here we go. Cleveland Browns. Boy, I tell you, they look like, I don't know. I mean, I'm not sure what Cleveland's going to do this year. They certainly got beat up the first week. Can't remember what they did the second week. But this guy, David Bell, we've heard him a little bit, wide receiver. Unfortunately, if you have him, he's got some kind of hip. I wasn't able to figure out, but he's out. He's on, I should say, potentially season ending and IR is what I read. So what do you think's going on with that hip? Is that a femoral neck fracture or something, you think?
Yeah. He basically dislocated his hip.
Oh gosh.
So he had a full dislocation. I don't know the details. We've seen that happen a couple times.
Yeah.
Tua was somebody who had a dislocation way back in the day. Bo had had a dislocation when he was back in the day as well. And the fact that they're talking about doing surgery quickly suggests that he probably had some type of a small bony injury there. Yeah. And so they want to do something to stabilize the hip. Usually if it's a native dislocation, there's a lot of soft tissue disruption, maybe damage to the labrum, but a lot of times that will actually sort of sit or rest for a little bit, and then they'll decide, do they need to do something later? So the idea that they've already said season-ending IR and that they've already said he's going to have surgery, he might be like Tua where, there's some compromise either to the shape of the socket because of a fracture, or there's a piece of cartilage entrapped in the joint and they need to take it out. So the bad news about that is what we've seen in the past. Tua's been very lucky, not for his head, but for his hip. Yeah. But Tua's been very lucky with his hip injury. But when Bo had his back in the day, he ended up with what's called avascular necrosis. Right. So the blood supply was disrupted. And so he ended up, the hip joint collapsed over time. Yeah. And that's really what shortened and ended his career. So,
well, that hip joint, it's got a really interesting, it has a very limited, it has one artery going to the ball. Basically, and that's the femoral artery, if I remember right. Anatomically, you can jump in here, but and that's what Bo did. Bo just, the mechanics of the Bosworth tackled Bo Jackson in Seattle from behind, and I think it lacerated that artery. Did it not interrupt that blood flow and that's why he had the necrosis? Am I remembering this right?
Yeah, exactly. Yeah, there's a combination of things that support that area, but there's a big, thick ligament in the middle called the fovea, and that attaches basically in the center. And so between that getting disrupted and then what we call the periarticular blood supply, which are the vessels around it, that's what can really compromise. And if you lose that blood supply up into the head, your bone just starts to, it's like in an apple, you drop off the side of the table.
That's right.
The ground gets soft and it collapses.
Yeah. Just for our listeners, from a physiology standpoint, biology standpoint, your tissue to heal, it's so important. That's what we work on as physical therapists, is really promoting the healing. And we do that by promoting blood flow and increasing blood flow, because the tissue to heal has to have a good blood supply, because your blood has the components that are helping that tissue, helps that tissue heal. And that's why we talk about where is the fracture, what type of fracture it is, what type of, injury is it, what's the blood supply, because that is so important. Dr. Hawkins, once again, man, week 2 already, I thoroughly enjoy our conversations. And looking back on it, I mean, you were really accurate last week. The only one we maybe looked at that we thought, and that was, I thought might play, is Kenneth Walker III. And he sat out with the Seahawks last week, and the Seahawks squeaked one out in New England. But he had an abdominal injury. They're saying abdominal injury, that oblique, but that's hard to come back from. I mean, that's your trunk muscle. I mean, you do everything from your obliques pretty much. What do you think about Kenneth Walker?
Yeah, I think those are the hardest ones to predict, because again, the severity of it and like what he's feeling, as a typical aside, I get out and do a lot of trail running, and I took a bad fall and hit a rib, and I did it about 6 weeks ago. And like, if I sit up the wrong way, if I twist the wrong way, like, it still kills. And that's 6 weeks out. And so you imagine, you'd like to say, hey, they're great athletes, they're being treated all this way. But if they try to warm up and they take a hit there and it's still uncomfortable, that's why it's not an exact science predicting some of these things and how quick somebody can come back.
No, and you're exactly right. And you have to remember too, as a running back, when you're driving your legs and you're in that pile and you're trying to keep the ball moving, I mean, you got to stabilize that trunk, and contracting those oblique muscles. If it's sore or irritated, it's hard to do. It's painful, So I'm wondering, I'm just throwing a guess out there. Since he set out last week against the Patriots, I'm not sure who's on Seattle's schedule this week. But you think he might play if it's a team that they need him back? I mean, Kenneth Walker III is going to play.
Yeah, they're lucky. They're lucky this week. They're playing Miami, so they're going to be dealing with Skylar Thompson filling in for Tua. So I think he could be one of those things where he warms up. Maybe he's dressed. They don't start him, and if the game's in control without him there, I could see them resting him another week.
All right. Dr. Hawkins, again, thank you so much. That's week 2. We look forward to talking and catching up in week 3. Good luck to all you fantasy football players out there, and we'll talk.